Do you struggle with your hands? Are they dry or flaky or irritated or itchy? I have some tips to help you out. Hey there, I'm Dr. Sam Ellis, and I'm a board-certified medical and cosmetic dermatologist in Northern California. I'm here to help you understand your skin and find products that work for you. If that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. I feel like when it comes to the skincare world, hand care specifically doesn't get a ton of time or attention or love. But the reality is, issues with hand skin come up all the time and they're very, very prevalent. And so I want to give you some tools and some guidelines to take better care of your hands. And speaking of guidelines, that's all this video is, a guideline. It is not a substitute for personalized dermatologic care. So if you have really been struggling with super itchy, super flaky, super painful hands that you can't seem to get better taking sort of the normal measures that are outlined in this video, please, please, please see a dermatologist. And before we talk about treatments and interventions, I think it's important to take a moment to talk about inflammation on the skin of the hands. Oftentimes this looks like dryness. People come into my clinic all the time and say, my skin is dry, my hands are really dry. But when I look at it, it's not just dryness, it's low-grade inflammation that manifests as flaking, itchy skin. And so people perceive, oh, it's just that my hands are dry. But oftentimes there might be something else going on there as well. We have a term in dermatology called hand dermatitis, which essentially is a catch-all term to encompass any type of rash on the hands that doesn't have a clear source or cause. It literally means inflammation of the skin on the hands, and we typically reserve this term for when exclusively the hands are involved. Because if someone has a body rash, we usually can tie their hand rash into that. For example, people who have atopic dermatitis, or more colloquially known as eczema, they often will have hand involvement, and in that case, we don't call it hand dermatitis, we call it atopic dermatitis of the hands or hand eczema. But the reality of the situation is, oftentimes people don't have a rash elsewhere. It's exclusively involving their hands, and oftentimes we have to call it hand dermatitis until we sort of rule out some potential other causes. And when it comes to hand dermatitis, most commonly it is due to multiple things influencing the skin on the hands simultaneously or sequentially, and we're going to talk about those. By far and away, the biggest contributor to hand dermatitis is irritation, and irritation can sometimes be a little bit sneaky, so repeated hand washing for sure can irritate the hands. Exposure to cold, dry weather, or even really hot weather can irritate the hands. Using things like hand sanitizer repeatedly or touching some type of chemical that you might not even be aware of at work can do this. Another really common contributor to hand dermatitis is repeated trauma. And I'm not talking like slamming your hand in the door type of trauma. I'm talking about frictional trauma. So say you play a sport, like you're gripping a baseball bat or a lacrosse stick over and over again. You can have some micro trauma on your hands. If you do gardening or you do other types of manual labor, that's another way that you can sort of incur small amounts of trauma on your hands over time, but that also makes you susceptible to other types of irritation, like I just mentioned. So you can see how these things start to add up. Another thing that leads to hand inflammation, which is not really super common, but because I'm a dermatologist, I see it all the time, is an allergic reaction or an allergy to something that your hands consistently come in contact with. And it's not something your hands have to come in contact with every single day, but maybe a few times a week or even every couple of weeks. And that's enough to keep that hand dermatitis or that inflammation on the hands going. So irritation, allergen exposure, and trauma are sort of like the holy trinity of hand dermatitis. And if someone comes to me as a dermatologist with chronic inflammation of their hands, those are sort of the first three things I look at. Now, one little tip, if you're a healthcare professional who treats patients and someone comes to you with a complaint of chronic hand inflammation, it's really important to have the patient undress and to look at the rest of their skin, because the patient might be hyper-focused on their palms because that's what's causing the most strife in their life, but they might have a tiny little rash elsewhere that gives you a clue to the diagnosis. So for example, they might have a little bit of psoriasis in their belly button that lets you know that, oh, they're dealing with palmar psoriasis in this case, or they might have a little bit of eczema behind their ears, and that might let you know, oh, they have atopic dermatitis that might be primarily manifesting on their hands, but they have it elsewhere. Or they might have fungus all over their feet that has transferred to their hand or has caused sort of a systemic inflammatory reaction that is leading to this hand dermatitis. So it's very important to look at the entire patient, even if they're just coming to you for their hands. Sorry, I had to say my piece on that because I have seen too many times people had something very obvious going on their body that was causing their hand dermatitis, and it was just missed because the patient didn't take the rest of their clothes off. Anyway, the reason that hand dermatitis is so persistent and consistent is because people have chronic, repeated exposure to allergens and irritants and trauma to their hands that if this was going on somewhere else on their body, they would easily be able to kind of protect that area and give it a break. But it is so hard to give your hands a break. You need them for everything you do. Aside from having to contend with a uniquely intense exposure to environmental stressors, the skin on your hands is also super sensitive. So once it gets revved up by irritation or an allergen or trauma, it will start reacting to things that normally wouldn't cause a problem. So the hand soap that you use every day and normally hasn't caused an issue, once the hands are a little revved up and inflamed, now you're gonna have a problem with that hand soap. And that's what makes it extra tricky to treat. This is all in anticipation of saying that the number one, by far and away, the best thing you can do if you have chronic hand dermatitis is to avoid irritants. It is the hardest thing to do, but it is the best thing to do. It's not about the hand lotion. It's not about the cotton gloves at night. We'll talk about that. It's really about avoiding potential irritants and babying your hands like crazy. It's a very well-documented phenomenon that people's hand dermatitis gets miraculously better when they go on vacation because they're essentially taking a forced break from all of the normal irritants, allergens, and trauma in their day-to-day lives. So I guess if you get any bit of information out of this video, it's you need to go on vacation. But in all seriousness, if you struggle with chronic hand dermatitis, then you need to cut the irritants out of your life. So you should not be touching soaps or detergents. You should not be exposing your hands to wind or dry air, which might mean you need to wear gloves or protect your hands. And we'll talk about that as well. It means that there are certain chores that you might not be able to do or you shouldn't do. And sometimes people go, well, Dr. Ellis, that's like not practical for how I want to live my life. And what I tell them is, I get that. Like there are compromises that have to be made and sometimes there's no perfect solution, but it's all about how much does this bug you? How much do you want to get better? And what kind of sacrifices do you need to make to meet your goals? So if hand dermatitis is something you think about all the time, it affects your quality of life, it bugs the crap out of you, then you need to cut those potential exposures out of your life. If your hand dermatitis is sort of a mild nuisance and you come into the clinic and you're like, yeah, this bugs me, but like, I can live with it, then it's fine. You don't have to make any major changes in your life. It really is about how much you want to get better, how much something bothers you, and it's always a balance. The reality of chronic hand dermatitis is that it is super stubborn and super easily triggered, essentially. And so the goal when it comes to improving your hands really should be improvement, not complete clearance, because oftentimes people who are prone to hand dermatitis will always have a little bit of that dermatitis or low-grade inflammation running in the background. The goal is to improve your hands to a point where you can go and live your life and function in your normal daily activities without thinking about your hands all the time. One of the best things you can do if you suffer from chronic hand dermatitis is to make gloves your best friend. You're going to invest in a lot of gloves and it's worth the investment. It's not practical to tell someone to avoid touching everything in their life. You need to use your hands to do most daily functions, but you can use gloves to protect your hands from potential irritants. You need to use them for wet work protection. So if you are washing dishes, if you are moving the laundry from the washing machine to the dryer, you need to put gloves on. If you are bathing your child, you need to put gloves on. It's all these tiny little exposures to water and soap and irritants that add up and cause hand dermatitis. It's not like anyone is sticking their hand in caustic chemicals every day and going, oh, yep, that's what's causing my hand dermatitis. It is these tiny exposures that add up. Now, I'm not saying use a public restroom and then don't wash your hands if you suffer from hand dermatitis. There will be compromises that need to be made, but anytime that it's reasonable to put on gloves to protect your hands, you should. It's also important to wear gloves to protect you from what I would call dry irritants. So probably the most common activities that lead to this are gardening, weightlifting, where you have a lot of friction on the palms, and then also just normal daily activities where your hands are exposed to cold, dry air. This is probably the most neglected, but one of the most common issues with people who have chronic hand dermatitis is their hands get really chapped when they go skiing or when they're running errands during the winter. You need to have your hands in gloves or shoved in your pockets. Another thing that's important to keep in mind when it comes to using gloves is whether or not you want to bring them into your nighttime hand care routine. So overnight, putting on a nice thick hand cream or moisturizer, and we'll talk about some recommendations in a little bit, followed by a pair of gloves can really help seal in moisture. Also, if you're using some type of medication on your hands, talk to your dermatologist before you do this. And then applying a pair of gloves can help enhance the efficacy of that medication. You can use plain white cotton gloves, that's fine, but actually vinyl gloves work even better for this. I recommend investing in a few pairs of heavy duty vinyl gloves. I like these better than rubber gloves because sometimes people have a rubber or latex allergy. And I'll link some options in the description box, but buy a few pairs and kind of have them spread all over your home where you might be tempted to touch water without them. So by the kitchen sink for when you're doing dishes, by the laundry, by the bathtub, etc. If you develop a hole in any of your gloves, you need to toss those gloves immediately. Wearing gloves that have a hole in them is worse than wearing no gloves at all, because as soon as something gets trapped underneath that glove, it goes through it, it's going to get pressed up against your hand and cause more problems. If you like to cook, it's also worthwhile to think about wearing gloves when you do activities in the kitchen. And I know that sounds annoying and not very sexy, but when you peel potatoes, when you chop garlic, when you peel onions or tomatoes or citrus fruit, it's so important to have your hands protected because again, it's all these little exposures adding up. Essentially, anytime you're doing an activity around your home and you think, I'm gonna have to wash my hands after I do X, Y, or Z, you should put gloves on. If it's wet work that you're doing, then I do recommend using a pair of waterproof gloves like those vinyl gloves. But if it's dry work, like you're just wiping down a countertop or you're doing some other type of chore or you're changing your baby's diaper or whatever, you can use cotton gloves, that's fine. And when you're done with the activity, you just take your cotton gloves off, you put them in the laundry, and you don't wash your hands. In dermatology, we sort of have this saying for people who suffer from chronic hand dermatitis, and it's wash your gloves, not your hands. So anytime that you could put on a barrier of protection and get away with not washing your hands afterward, you should absolutely do that. It sounds annoying, it sounds like a pain in the butt to do, and it is. It's not the easiest way to live your life, but if you suffer from chronic hand dermatitis and you want to do everything in your power to try and get better, it's worthwhile. And then when you're outside in cold or windy weather, wearing a pair of unlined leather gloves is the best way to prevent dryness and chapping of the hands. Sorry I had to go hardcore on gloves there, but I cannot tell you how much of a difference they really make, and that's why I emphasize it so much. Other things you can do to protect your hands. When you do have to wash them, you want to use lukewarm water and the most mild, gentle soap possible. I actually really like using just a gentle facial cleanser like a CeraVe gentle wash or a Cetaphil gentle wash, and that's just a nice way to not overly strip your hands. You do not need super strong antibacterial soap, and definitely do not be washing your hands with dish soap. I see that so many times and why? Also, if you're someone who wears a lot of rings, you want to make sure that you remove your rings before you wash your hands. Sometimes little irritants, soap, etc. can get trapped under your rings and cause more of a problem. And then every single time you wash your hands, you need to apply lotion afterward. This means often buying multiple bottles of lotion, having them stationed all over your home, keeping one in your bag, keeping one next to your faucet at work, etc. Because every time you wash your hands, you're doing damage to the skin barrier there. And by following it up with a good supportive hand lotion, you're taking at least one step towards repairing that barrier and reducing inflammation in your hands. My all-time favorite hand lotion, I talk about this all the time, is Gloves in a Bottle. This is the best, especially for hand lotion that you have to apply during the day because it's non-greasy. It essentially forms this very thin film barrier over your hands. So one, it doesn't transfer to other things. So you can go type on your computer afterward or turn a doorknob and not leave sticky handprints behind. But two, it's like this barrier of protection. So if you are inadvertently coming in contact with potential hand irritants over the course of the day, your hands are additionally protected. I feel like after I went on my rant about how important gloves are, it's only fitting that the number one hand lotion that I recommend is Gloves in a Bottle. I remember when I first posted about this on my Instagram, I got a lot of messages saying, in cosmetology school, this is something that a lot of our teachers recommend because of course we can't really wear physical gloves when we are cutting someone's hair or washing someone's hair at work, though I would argue you could if you're washing someone's hair. But regardless, using Gloves in a Bottle is sort of the next best option. I also really like the Aven hand cream. This is maybe like my third or fourth bottle of this. It's kind of addicting in a way. Not that it's actually literally addicting, but it just makes your hands feel so good, and it's a very luxurious experience to apply it. So this is one that I leave sort of on my bedside table. It's also one that I keep in my purse because I feel like In addition to being effective, the packaging is a little more chic, so it's a lot cuter to pull out in public than this guy, though I'm not above pulling this out in public, that's for sure. I love that one as well, but that's another option. And then probably the heaviest hand cream that I use is the Neutrogena Norwegian hand cream. This one much more feels like an ointment. It's a lot greasier, it's a little bit stickier, so that to me is like a nighttime only hand cream, but it's really thick. It's great for locking things in, and sometimes if someone's going to put cotton gloves on at night to sort of lock in their moisturizer or the ointment that they're using, that's the one I will recommend. Another product I want to talk to you about when it comes to hand care is Superglue. And you might think I am crazy for saying this, but ask pretty much any dermatologist. We're pretty much all on the same page here. If you have little fissures, which essentially are tiny little cuts in your fingers or on your hands, they can be incredibly painful. And one thing you can do to help with the pain is to put a teeny bit of Superglue right in that cut. You're not going to get systemic absorption of the glue. It's not going to cause a big health problem. And as your skin is supported and as it heals, it'll sort of just force that glue up and out and it will peel right off of your skin. I have literally had hand dermatitis patients come into my clinic and go, Dr. Ellis, you won't believe it. My last dermatologist was absolutely crazy. Can you believe they told me to put Superglue on my hands? And that's where I kind of have to get real and be like, I do believe it because it can be incredibly helpful. People who also get big cracks in their heels, you can also use Superglue in this case. Again, run it by your dermatologist, make sure they're okay with it. But when done correctly and precisely, it can help so much with this discomfort of fissures. The last thing I sort of want to talk about is topical steroids, because a lot of times one of the best things and one of the most effective things for helping with hand dermatitis, aside from all of the lifestyle interventions that I talked about, is using topical steroids, which are very potent anti-inflammatory medications to help calm down the skin. Like I mentioned in the beginning of this video, when the skin on the hands gets irritated, it then becomes hypersensitive to everything in your environment and even things that normally weren't bothersome. And so steroids sometimes can be a great temporary solution to help reset the skin on your hands so that it can tolerate the stuff that it used to be able to tolerate. Steroids get a really bad rap, but when used correctly under appropriate guidance, they are life-changing for people. And I don't want people going around suffering because they're too nervous to use a steroid when in fact they can be extremely effective for people. Also, going back to the beginning of this video, if you're doing all the right lifestyle interventions and your hands are still not getting better, for sure get plugged in with a dermatologist. There might be additional diagnostic testing that can be done. There might be other types of medications or interventions that we can offer you, but your hands are part of your everyday life and we want you to be comfortable with them and we can help you do that. I also really debated if I should talk about fingernails and nail care in this video, but I truly believe that deserves its own dedicated situation. So if you want a video on how to take care of your nails and how to solve some common nail issues, let me know in the comments and I can definitely make that for you. Do you have a favorite hand cream? Put it in the comments below. Also, if you have any additional tips or tricks for taking care of your hands or something that you have found particularly helpful, put it in the comments. As always, thank you so much for watching. I love having you here. Don't forget to like this video and subscribe, and I'll catch you in the next one.